Just one day after the CDC recommended easing mask restrictions for people fully inoculated against COVID-19, the CDC says that it's investigating 2 new cases of rare blood clots linked to the Johnson & Johnson vaccine. There are now at least 17 confirmed cases of blood clots in people after taking the J&J shot, and more than 8 million doses have been administered. Health officials lifted a pause on the vaccine just last week, but added a warning about the potential for clotting. Meantime, Pfizer is developing an oral drug to help treat COVID at the first signs of any symptoms, and the company says the experimental drug could be available by the end of the year. So with more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. Thanks for joining us, doctor. So let's talk about this Johnson & Johnson shot and the connection to blood clots. I think that, when we say to people, oh, right now it's only 17 cases and 8 million doses, don't worry about it, I think it's a little dismissive of people's concerns. If you're somebody who ends up with a blood clot, it doesn't matter how rare it is because, it's a serious condition. I think what people need is information about the risks. So, what do we know now about the risks? What do we know about the risks of getting COVID versus, this blood clot? And also, whether there are risk factors, people who may be more vulnerable to a more severe side effect. And maybe those are the people who need to be concerned, and the rest of us can relax.
Good morning, and I think, Anne-Marie, you've raised a lot of important points here. I agree. I think it can be too dismissive to say, listen, it's just occurred in 17 people out of, millions of doses, and anyone who's getting the J&J vaccine is thinking, well, what if that's going to be me? And so, the pause that they had on the vaccine earlier this month was largely so they could try to identify if there was some kind of common factor happening here. And when they finally did lift the restrictions on the vaccine, it was with some caveats. So speaking to what you were just discussing, giving physicians and people receiving this vaccine greater knowledge of who these reactions were happening in and what to look out for if you do get the J&J vaccine. So that's really important. And typically what we're seeing is that it's happened in women and younger women, especially in their 30s. In fact, in Europe, AstraZeneca, which is a similar type of vaccine and that's had similar reactions, has actually been paused completely and restricted in some countries in people who are younger. And they're only giving them in people over 55 or 65 in some of these countries. So that's something to think about. But what we're looking at is a condition that this vaccine causes where we see thrombosis, which is clots in atypical areas. It's specifically the main cases have been in the brain. There can be clots in the legs. This gentleman that you just discussed in one of the segments in California is one of the first men that it's been detected in. I think it was a blood clot in the legs. This can also be in the lungs. They've also noticed clots in the abdomen. So what are we looking for? Specifically, in the brain clots, we're looking for people who might develop a severe headache, fogginess, feeling of lethargy, and this usually occurs within 2 weeks of getting the vaccine. So it's really important to know also that it's not just the COVID vaccine is associated with headaches, but this is not just a mild headache. It's a persistent headache. It can be very, very painful. These are things that we want to have people know about so that they can seek help from their doctors and physicians in all parts of the country be aware of when they're seeing people post-vaccine.
There's also, as you know, Dr. Ogden, being this heavy focus on the Johnson & Johnson blood clot cases, but there hasn't nearly been as much attention about potential heart issues in the Moderna or the Pfizer vaccines. The Department of Defense says it's tracking 17 cases of cardiac inflammation among Pfizer and Moderna recipients. The DoD says more than 2.7 million Pfizer and Moderna shots have been administered. What do you make of that?
Yeah, so this is the Pfizer and Moderna vaccine being associated with something called myocarditis, which is an inflammation of the heart. Actually, initial reports of this were coming out of Israel, where they saw, again, very few cases out of the millions of people who have been vaccinated, younger people who developed myocarditis. You know, we're still trying to figure out what's going on here in the United States. About 13 or 14 cases have come out of the military when people have been vaccinated. This condition, we see people develop chest pain. Again, it's something that's like more severe than my chest sort of hurts. It's like very constant. It's extremely painful. You might also notice swelling in your legs. You might feel short of breath. So basically, we're identifying the symptoms that when people get any of these vaccines, they can quickly go see their doctor. This is not something you ever want to sit on any of these, whether it's with the clots or feeling shortness of breath or chest pain, and say, I'll just call my doctor on Monday morning. You want to take them seriously. Right now, again, we just don't have enough information. We do know that COVID in and of itself very much has affected the heart. And one of the people in the military who was reported to have the myocarditis did have a previous COVID-19 infection. But again, we're not sure if there's a relation there. And we're not really certain why this is happening.
So Pfizer, as we just heard, has announced that it's developing an experimental at-home pill that it says would treat COVID-19 in the sort of early stages, the first signs of the illness. The company's hoping to have it available by the end of the year, but some critics say, listen, we already have vaccines, which are actually not fully approved. You know, they're also sort of experimental. Now we got this experimental drug. There's Pfizer's talking about a booster shot, maybe. I'm wondering sort of what your take is on this. And is there a concern about the impact that it will have on the consumer, on us, when we're kind of being bombarded with all these possible COVID-related treatments that we know are all sort of cutting edge, but also experimental? Sometimes you get the sense that for a lot of these drug companies, obviously this is a great way to make money if they can find something to sell to us that is related to COVID.
You know, I think that with this drug, we really have to look at it as a game changer. We haven't seen medications even discussed on the horizon that one can take early on or even prophylactically if you've been exposed, kind of like we have for the flu. Yet we haven't heard about this. And I really think that this is the kind of focus that we need at this point, not just on vaccines, because, you know, the virus continues to mutate and it will continue to be present in some form. And we need to have these kinds of remedies that we can take at the first sign of symptoms that will prevent spread, that will prevent severity, that will prevent hospitalizations. But I definitely see what you're saying. There's a lot of newness out there, and it's a lot for people to digest. I do like the timeline that they're suggesting. It wouldn't come out, you know, I'd love to see a drug like this right now. And maybe we could bypass some of these people who are so hesitant about the vaccine, and this would be, you know, at least something else out there that could hem the spread of the virus. But I do think it's something that it's, you know, going to be a game changer, and I think that it could be something that will change the nature and the landscape of the virus and our ability to sort of go to work or something if there are cases of COVID-19. But I like the time frame. I think that they're going to do, you know, due diligence about looking at the study, looking at the correct age groups and the safety data. And we do have these kinds of medications called protease inhibitors for other diseases like hepatitis and HIV. So they are known entities that we will have some background of safety about as well.
Dr. Ogden, I got to ask you before we go, the CDC, as you know, announced these new guidelines on Tuesday for people that are vaccinated, saying that they don't have to wear a mask outside. The question, of course, is, was there ever any concrete scientific medical data that suggested that outdoor transmission was a real thing? Let's say, for example, while you're out jogging or if you're in the park, you know, where you're sort of socially distant from people. And do you think that this could be problematic in states that are seeing some spikes, or not really?
You know, I think that we always have to keep in mind that this is a novel virus, and we we just may not have known and had enough information to and we saw that the effects of it were so devastating. So the tendency was to err on the side of caution. So yes, while the chance of transmission when you're outside or jogging and there's not someone near you was low, because there was such a devastation happening, I think that there was always this word of caution. And now we're seeing that with that extra layer of protection of vaccination, we can loosen this up even more. So without a doubt, getting infection from an outdoor environment, the risk has been low, and it's been shown to be low. But you also want to think about context. They talked about crowded spaces. So how close are you to people? How much talking and yelling is happening? These kinds of things still do matter, I think. And we want to be thoughtful about that, especially in places where people are still not vaccinated on that level that we'd like to see, where there's such a incredible amount of protection that you feel safer.
Dr. Neeta Ogden, giving us the answers to put our minds at ease. Thank you very much.
Thanks for having me.